Today topic of discussion thrombosis. How we define that thrombosis? Thrombosis is the formation of blood clot. That blood formation, solid mass inside blood vessels or heart. Okay, from that flowing blood obstructing the flow of blood through the circulatory system without any injury. The primary and secondary blood formation occur. Last video we discussed hemostasis. That one is the physiological phenomenon, this one is the pathological okay, this one is the pathological one. Whenever a person having injury, primary and secondary blood formation occur in hemostasis. But that one is the physiological process. Here, this one is the pathological. So, that lining is intact, no injury, no damage. This is the organ, blood supplying to that organ, no injury here. Without any injury, platelet are coming. Okay, so here without any injury, platelet are coming and forming blood. That are, they are showing addition, activation and aggregation. Three processes also occur here and they form blood. First primary blood formation, second secondary blood formation. So here fibrin, platelet, thrombus. Okay, only things without injury. So blood flow to this organ obstructed. So blood flow to this organ is obstructed. So that organ shows ischemia, hypoxia and necrosis. So here it will affected that blood flow. So this organ having ischemia, hypoxia and necrosis. So with injury it's good that blood formation, primary and secondary blood formation is benefit for us, but without injury it not good. So this one is harmful for us. The name of the disease name is called as thrombosis. So this name is called as thrombus. The name of the disease name is called thrombosis. Not only single, not only like this, multiple thrombus, multiple organ, multiple thrombus, all the organ. Okay, not only single organ, all organ, it will causes thrombosis. So what is next? What is embolism? Thrombus is attached to that blood vessel. See here, it will attach to the blood vessels. Okay, so this name is called as thrombus. Attached wall of blood vessels. But this one, this embolism. Okay, this one was distract. Okay, so distract here, it is flowing that blood. Okay, it is flowing that blood flow, solid ball or clot. That name is called as embolism. Okay, that process name is called embolism. So hemo stasis occur after injury to CVS. After injury causing process name is called hemostasis. Thrombus unruptured CVS without injury it will causes. So it was harmful to that particular organ. It will causes ischemia, hypoxia, finally cell death. So this one is the diagram of that thrombus formation. Okay, this one is the blood vessels without injury, and the red color one is the platelet, that wire, this one is the fibrin. So primary blood followed by secondary blood. So here uninterrupted blood flow here. So this one is the normal blood flow. Okay, so uninjured blood vessels, here no injury, uninjured blood vessels, still thrombus formation. Here once detached. Okay, this name is called as embolism. Uninjured blood vessels, thrombus and embolus occur, embolism. Next, pathogenesis. Why this one happen? Why thrombus formation. What are the reason? The scientist who explained the name of the scientist Virchow. So, Virchow triad. Pathophysiology, Virchow described three primary elements which predispose to thrombus formation in human body without injury. So it have that name Virchow triad. So this one important short answer also, pathogenesis is the reason why the thrombus will happen. Virchow triad because of three reasons. One is endothelial injury, second one is altered blood flow, third one is hypercoagulability. First one is endothelial injury, second one is altered blood flow, third one is hypercoagulability. These three are triad of Virchow. So, Virchow triad explained the pathogenesis of thrombosis. He explained predisposing to thrombus formation without injury. Three reasons. So, first one is endothelial injury, not sub-endothelial, only endothelial injury. Then altered blood flow. Two method of blood flow. One is stasis and turbulence. Okay, third one is hypercoagulability. So first one is endothelial injury. The integrity of blood wall. Okay, the integrity of blood walls is important in maintaining normal blood flow. That blood wall is important for normal blood flow. Whenever we have any cut, what will happen? Due to the cut we have injury, endothelial and sub endothelium also. So because of that gap, okay, so blood will flow out. So blood will come out, bleeding takes place. So stop bleeding, blood formation, stop that blood. So that one name is called as hemostasis. But here, due to some toxin, okay, due to some toxin, toxin presented in lumina blood vessels, endothelium. So blood vessels, this endothelium destructed. Okay, so here it will affected endothelium. Toxin presented in blood, it causes endothelial injury, which is focal, which the integrity of vessel wall that can cause thrombus formation. It is deterring the thrombus formation. So the first reason, endothelial injury. Okay, then why it will happen? Lumina blood vessel having two type of material. One is prothrombic material. These are the example of prothrombic material. Thromboplastin, Van Willebrand factor, platelet activating factor, then inhibitor of plasminogen activator. So these are the prothrombic factors. Thromboplastin, Van Willebrand factor, platelet activating factor, and inhibitor of plasminogen activator. Another type of material, antithrombotic factor. Antithrombotic factor, heparin like substances, thrombomodulin, tissue plasminogen activator, then inhibitor of platelet aggregations. Okay, so always the prothrombic factor is equal and opposite to antithrombotic factor. Okay, both are equal and opposite. But whenever endothelial destructed, okay, in endothelium will affected, the time that prothrombin factor material increasing, antithrombotic material decreasing, so imbalance causing injury. So whenever endothelium distracted, both are thrombotic and antithrombotic equal and opposite. But whenever endothelium affected, that time prothrombic factor increasing, antithrombotic factor decreasing, so imbalance causing injury. Second one is alteration of blood flow. Normal blood flow. Second one is altered blood flow. Normal blood flow, axial or luminar flow. This one is the axial. That means normal blood flow. First, WBC, heaviest material center part, light material periphery. So WBC followed by RBC followed by platelet, then platelet followed by that plasma, then only endothelial cell is presented. Normal blood flow, axial or luminar blood flow. What is the meaning by axial or luminal blood flow? According to Bernoulli theorem, it is a pipe. Whenever fluid travel in the hollow pipe, the heavy portion travel in center, and lighter travel in periphery. So WBC is the most heaviest according to Bernoulli theorem. WBC center, then platelet, WBC, RBC, then only platelet. That platelet are separated from endothelium by rim of plasma. So here plasma is presented, here endothelium is presented, here platelet is presented. So platelet are separated this endothelium by plasma. So because of alteration of blood flow, two type of blood flow. One is turbulence, that means unequal. Second one is stasis, that means slowing. So normally blood flow like this, so it may be turbulence like this. Okay. Due to this nor that gravity they will fall. Okay, so due to gravity here only that platelet will moving, this one will fall down. Okay, so that platelet they will fall. Migration. Okay, so here migration, turbulence and stasis are altered that blood flow. Turbulence mainly arterial, reason for the thrombosis in arterial. Turbulence, reason for thrombosis in vein because of that stasis. So this one is arterial, this one is vein. So here axial blood flow converted. Okay, so axial blood flow is distract and converted into reverse axial blood flow. So platelet come and contact with the endothelial cells, so they start forming thrombosis. So that platelet will come down, so it will contact to that endothelial, so it will causes thrombosis. Third one is hypercoagulability of blood. It also called as thermophilia. In this one, defined as any disorder of blood that predisposes to thrombosis. There are two types of hypercoagulability. One is hereditary, it also called as primary. Second one is acute, it also called as secondary. Normally this one is the blood vessels. Here we have that two materials. We know prothrombic material and antithrombic material, PT and AT. Prothrombic and antithrombic material is presented. So they are many that AT, antithrombotic things which are enumerating them. Normally there are opposite and equal. Okay, prothrombin is equal to an antithrombin, so they are balancing each other. Some reason they may be hereditary or it may be acquired. Okay, both occur simultaneously. As a result, thrombus formation. Here also always we know both are equal and opposite because of hereditary condition or acquired condition, both are imbalancing, so that reason it will causes thrombus formation. What are the example of hereditary? Antithrombin 3, protein C, protein X, mutation factor 5 Leiden, then defect in fibrolysis, then decreasing coagulating factor 2 and 8. Then what are the acute factor? Risk factor aging. Okay, then prolonged bed rest. So this person prolonged bed rest mainly affected that leg part. Here that thrombus formation will happen. Then long travels, then clinical condition like heart disease, vascular disease, shock, tissue damage, late pregnancy, and some kind of drugs causes thrombosis.